Okay,
All right, perfect. Well, thanks for joining me.
welcome.
It's um it's interesting with the whole rolling thing. I don't know if you've heard about athletes who roll and the benefits of it. I wasn't very aware of the benefits of massage rolling, and as I was doing more and more endurance events, as I was really getting into all the endurance events, I was finding that I was having issues with what I thought were my joints, joint pains. I was having a lot of back pain. Welcome. I was having, uh, a lot of inflammation, and I went to a chiropractor slash, it was like chiropractor slash physical therapy. And they got me to use a foam roller for the first time. And I thought this was a torture device. I could not believe the amount of pain. And it was, I've always had issues with my right leg, but even minimal pressure on the muscle was causing a lot of pain. And I said, this is wrong. I shouldn't be having pain like this. And they told me something that was really interesting, which I realize now is true. Healthy muscle does not hurt when you push on it. So if you have, non-injured part of your body and you push on it, it shouldn't hurt, right? So if it hurts, it's telling you that there's something going on, inflammation, etc. Hello, welcome.
Hi. Thanks.
So anyway, I'm telling the story of my rolling experience. So they said that what you actually have to do is to do it more. I mean, if it hurts, you actually have to do it more, which I thought was crazy. But it turns out that what ends up happening as we exercise and as we age is that anytime we are doing activity, our muscles get inflamed. That's a normal thing that happens because you have little micro tears in your muscle fibers. And so when muscle fibers tear, they then get fluid around them and they get inflammation and then they heal. But the way that our bodies heal is it makes scar tissue. So it forms with scarring. And so when you have healthy tissue that heals, it does not heal in the soft, pliable way that it should, right? If you can picture, if you get a cut and you get a scar, that scar does not behave like your normal underlying skin, right? It's like tough. So, so how do we address this? Well, first of all, if you have scarring that is occurring as you're exercising, what it's going to do, it's going to cause limited mobility. So I'm going to use the example of a knee. Okay. So with your knee, you have the quadriceps, and then you have the patella, which is the kneecap. And the quadriceps comes down and forms a tendon, which attaches to the patella. Okay. So when the quadriceps contracts, it tugs on the patella and it lets your um, your lower leg extend. A lot of people get knee pain, and it turns out the knee pain isn't actually coming from what's going on inside the joint itself. The knee pain may very well be coming from the quadriceps tendon being tight. And why is the quadriceps tendon being tight? Because the quadricep is tight. And why is the quadricep tight? Because it has built up all these myofascial adhesions. That makes sense. So all this scar tissue has bound this up and is preventing it from really extending like it should. So when you're doing stretching, everyone knows that stretching is important for lengthening your muscles. Well, your muscles can't stretch if they're bound, right? So if you picture all the fibers, if they're bound, they're not going to properly stretch. So working, why deep tissue massage works, sports massage, etc. It's literally like tearing those little fibers that have formed to allow more mobility and allow the muscle to lengthen. So if you have tugging on a joint from the tendon not moving properly, that's going to cause inflammation and swelling. So you can have a lot of swelling and it's not coming from the joint itself, it's coming from the tendons that are getting bound up and yanking on the other part of the body, whatever it is, like the patella, or if you've heard of plantar fasciitis, same
Mm.
thing. So that's from the calf. If the calf is tight, then that puts a lot of pressure on your Achilles tendon. You can picture this is tight and it's tugging on the tendon, which then tugs on the heel, which then causes tugging on the plantar fascia. So it's all connected. And so what I recommend for people, and this was amazing how I went from being incredibly sore to then everything being pliable, more mobile. And I had even gotten to the point where I was almost doing a split, which I didn't do when I was a kid. You know, I was the worst ballerina. I could go like this. That's it. Ballet was not my thing. But now with the rolling and the stretching, it has really provided a lot of mobility, which really decreases the pain and the swelling. So as far as what types of you know tools there are a ton of different tools for this type of work. Basically, I mean, even your fingers, right? Like you can really do a deep tissue massage on yourself in a way, right? Like you really can use your fingers to kind of almost go along the edges of the muscles and try to strip the tissue and let things move better. But there are lots of different types of rollers. And I'll tell you a little later my story of why I actually invented one. And that has to do with your back issues. I can tell you about, I was having back issues. And so I couldn't find something, so I invented one. But anyway, there are lots of different types of rollers on the market. The most common ones are like these types, like foam rollers. They're solid on the inside and squishy on the outside. And basically what you're doing with this is you're, depending on what it is, you can do your whole body in like 5 minutes, but you're basically putting pressure on the muscle. You're like squeezing it in a way. So that's good. It's not terrible, but it doesn't really do. If you picture like what you want to do is that like that myofascial, almost like you're not tearing, but you're kind of moving the fascia along. Just putting pressure is not quite enough, but it's a start, especially if you're sore. Because when I started with the softest roller, I was in agony, and they were making me do my side here, my IT band, and I was like, I can't believe you're making me do this torture. So this is one type. The other nice thing about something like this size is that you can also use it to help your thoracic mobility. So you can like lay on it, and can you see me? And then just really stretch out your shoulders. Okay. Then there's a different kind, which is a handheld, something like this. So this has handles and these little kind of bumps, and you can use it for different parts of your body. This works a little bit better. You could see how you can kind of use the little depressions in there to kind of go along different parts of your body. So here I'm going along the tibia, and I'm avoiding the bone, and I'm hitting the muscles on either side, because rolling on bone is painful.
Yeah.
So handheld is another option. If you ever go to a soccer match, you see the soccer players on the side of the field. They're constantly like, if you go to any marathons, people are gonna be like do. They're bringing this with them and they're in the bus. So, you know, it's convenient. But as far as the back goes, and this is why I actually came up with this invention, but so you see you have in your back, you can't see, but you know how you have your spine down the middle, and then you have muscles to the side of your spine.
Yeah.
When you're having back pain, a lot of that is spasm of those muscles to the side of your spine. Okay. And so the question is, how do you get those muscles massaged? And the problem with this is that it doesn't leave space for that. Because if you try to do that, I mean, it gives you a nice crack. I don't know if you could hear it cracking, but the bones get in the way. And you can't really get a good massage of the muscles to the side. Now you can, you know, try by going like a little sideways like this, and a little sideways like this. But then what I did was I invented this roller that is, it actually is adjustable so that you can move it to however you want. So you can leave room for your spine there. And, or you can take these out and just leave these, or have the whole thing, or have just the little ones. And it's also handheld, so you can put handles on it that it comes with it. So for me, I use these things so much that I felt like I needed something that kind of ticked all the boxes. But for this, for example, you can see how if your spine goes in here, then the rest of your back muscles can be rolled over on the side here. So this was kind of a game changer for me. And this is actually part of my bedroom here. And I leave this mat and I leave the roller here 24/7 so that I can use it. And you can just, you know, roll up and down, and you're getting the muscles to the side of your spine. So different muscle groups that you can get. You can get your calves, pardon me, and your calves, as we mentioned, are very important for keeping the Achilles tendon nice and freely mobile. You can do your plantar fascia. So you can use, you know, a handheld roller and do your plantar fascia. It's a little bit awkward though, so I find that what works best for that. You can also get like a tennis ball if you have that around, and then you can do the bottom of your foot. And basically, it's like a shearing force. Okay, you're trying to really move the tissue and let it glide so that it moves more freely. Quads, I mentioned quads are really important. I actually this is my favorite way of doing this, but so quads, the way you do your quads, can you see? Just pull it down this way, and then you can move side to side. And the beauty is it doesn't hurt anymore. It doesn't hurt anymore because I do it a lot. And so the muscles aren't injured in that way. Hamstrings are really important. So if you ever get glute pain, rolling the let me show you this way. You roll the hamstring this way. The other nice thing about this is it has this little lip, so you can really use it to dig in. We talked about the back. You can do your flank. You could do your upper neck. So the neck part is a little challenging on usual rollers. Sometimes you need a friend to help you. Kind of rub back here. It's like getting a massage, okay? Like hiring someone to do a massage for you. With this one, what I did was I actually have these wall mounts that you can put, and it could just click directly in the wall mount, and so you can rub up and down and get the muscles to the side of your neck that way. They're a little bit more challenging with the traditional rollers. I mean, you can still do it with these more traditional foam rollers. They're just a little bit harder to do. But you can do that is, just kind of roll up and down, trying to have some friction between the skin and the tissue underneath. If you can picture that shearing force. So it kind of looks like this. So if you're putting pressure on the surface and then you're moving the tissue, okay, so you're really, pulling to almost dissect the tissue underneath the surface of the skin. So, so what I recommend to people is after a workout that you get a roller and you just do a general body roll for maybe 3 to 5 minutes before you do your stretching. Okay, so you roll first because now you're breaking apart the adhesions, you're breaking apart the myofascial restrictions, and then you stretch. So you're freeing up the muscle and then you're lengthening the muscle.
Yeah.
And that will allow you much, much better mobility. So any questions on what we've talked about?
Can we get one of the ones that you invented, Kathy?
You can get it on Amazon.
Oh, goodness, that's wonderful. Okay. What is it called?
It's called Pinnacle TRS.
Not Kathy's roller.
Kathy's roller. Pinnacle TRS. Yes.
PRS. Okay.
Sorry?
Pinnacle PRS.
TRS. Pinnacle TRS. It's therapeutic roller system is what it's called. Therapeutic roller system. And it's, I guess I can show you real quick if you're going to be doing that. It comes in a case, and then these parts are adjustable. They come out, and you can change.
That's good.
A small roller, a big roller, all small, all big, some small, some big. And then when they're on, as I mentioned, they're adjustable. They're adjustable in this way, so you can move it to adjust whatever it is that you're trying to get. Now, this for people who have never done it before, this, it's a little bit sturdy, like a little bit. It's squishy, but it's a little bit like sturdy. So do not panic if it feels a little bit challenging at the beginning. Like if you feel a little sore, because you can feel a little sore even from this. But ultimately, this is the thing that I have found. For me, I have a million of these types of things. My whole house was filled with rollers, and then now I just use this. But you're welcome to try other ones first if you want to. Please don't feel like you have to buy this. I just showed it as an example. But any rolling questions, any issues that you guys have ever had with your joints, your muscles aching, IT band syndrome, plantar fasciitis, quadratus lumborum, muscles of the neck, any issues that you want to talk about?
Well, I would just do for my lower back, and it's kind of, I don't know if that's where not where your kidneys are, but it's like really lower back on each side. And I'm thinking if I do that something like yours, with the space for the spine, I guess that would be hitting the right place.
Right, that's right. When you do it, make sure you start out because it takes a little dexterity to get used to something like this, especially if you've never done it before. So
Yeah.
you have to kind of lift up. I'm just going to demonstrate, okay? When you do your back, you have to lift yourself up a little bit and put weight on your forearms so that you're not putting a ton of pressure.
Oh
See,
yeah.
see, I can do a tiny bit of pressure or I can do all the pressure. And it depends on your forearms. How much pressure are you putting down?
Yeah.
Um, but the muscles to the side of your spine are called so immediately to the side are your paraspinals. And then at the very bottom of your spine, where they come out like here and they flare out,
Mhm.
yeah, that is called the quadratus lumborum, and it is a very typical place to get a lot of pain. And the rolling really does help. Really.
Great. Yeah, I'm going to try that.
Yeah. Any other issues that you guys have noticed? Anybody?
Now, I have a question though. I've used a roller a lot in the past. At some point, I felt like I was over rolling, like it hurt too much, like after, like I was too sore after. And then I was reading, and I can't remember now the details, but is it ever contraindicated? Is there ever a time you're not supposed to?
Yeah, so if you've had like an acute trauma, um, you really like the tissue's actually trying to heal. And so mashing on it will make it worse. Um,
Mhm.
so you definitely don't want to do that. The other thing is that some people tend to really mash on their tendons themselves, and that's not the part that is supposed to be uh, rolled. So, for example, your IT band, which is, I'm sure you guys can see me. So you have a muscle called the tensor fasciae lata, and then you have your IT band, which is kind of a strip of tendon that comes down this way. There's muscle underneath it, but sometimes if people have inflammation in their IT band, um, they do a lot of rolling. Actually, I think that was partly my issue too, and although the rolling eventually made it better, but rolling over tendon is not is not ideal. Okay, because the tendon itself, it's supposed to be like solid and durable. You're trying to break the adhesions in the muscle belly, not in the tendon itself. So
Mm.
I would, if the rolling is making something worse, definitely don't do it. The other thing with spines, which was another reason why I invented this one, so you can make room for your spine. But if you've had spinal trauma, so trauma on the actual bone, you should not roll with these kinds of things because that's going to be putting pressure on the spine directly, and it could potentially move um, that bone back and forth, and then put pressure on the spinal cord. So that's a big no-no.
Mhm.
And also, I would just generally say if you're doing something and as you're doing it, symptoms worsen, I would back off. I think your body's trying to tell you something. Like it's one thing when it's hurting while you're doing it, but then the next time it's hurting less, and the next time it's hurting less, then we know that we're moving in the right direction. But if you're having pain that is getting worse when you're doing it, I would say your body's trying to tell you something, like seek medical advice for that.
Mm, great.
Any other questions? That was a great question. Thank you.
I mean, it's pretty generic, this, but I know I'm older, and as you age, you have typical aging symptoms, like you stoop maybe, and what would a roller do to help that not happen?
To help to avoid the stooping.
Yeah, whatever.
Yeah. So part of this is going to involve being aware of what is happening. But what we end up doing is we end up doing a lot of, our chest walls end up being very contracted, and our shoulders move forward, and we don't have good thoracic mobility. So thoracic mobility is being able to move your shoulders to the side and being able to move your thoracic spine and have the ability, like, to move your arms out like this, for example. That is a big part of the muscles in the back. Okay, so what this type of thing does is, again, allows for that mobility to allow you to open your chest wall. So, doing some rolling of your anterior chest, for example, you could do that on the sides. You avoid your breasts, but you can do it on the sides, and then also around your scapula. But then there was the other one that I showed you, that you can lay down on this one if it's complete, and you just let your arms fall to the side. But so you can roll up this way. It actually feels really good without hitting your breast. Swimmers do a lot of this, and bouldering, people who boulder. Anyway, but that doesn't address your thoracic spine issue. But definitely being conscientious of position is very important, but having that freedom. The other thing you can check is after you roll, so specifically for your posture, get yourself to a wall. Have a very good. Well, okay, I'm going to pretend that I'm against the wall. Okay, pretend I'm against the wall. And then you go up and down like this, keeping your shoulders touching the wall, and then your arms up and down. And if you are having trouble doing that, that's okay. You keep rolling and practicing, and eventually you'll get that mobility. And that allows you to have your process, find your vertebral bodies all lined up in a nice neutral position.
Great, that's helpful. Thank you.
Yeah, you're welcome. Any other questions? I know it was just the two of you today.
I know we're on the spot, but that was really helpful. I'm going to enjoy that. I think it'll be very, very useful.
Okay, great. All right, very good. Well, if there aren't any questions, I'll let you guys have your Friday evening back to you. And as always, any questions, just shout out on the chat, and I'll be happy to answer them for you.
Thanks, Kathy. That was wonderful.
No problem. Take care.
Thanks.
Bye. Thanks. Bye.
Bye.